Welcome to this workshop on the Cornerstone Process, a holistic 5-step biopsychosocial spiritual model for healing, recovery, and conscious evolution. This process is covered extensively in the Real Self-Love Handbook. As an integrative physician, acupuncturist, and trauma recovery therapist, my journey into the realms of resilience and post-traumatic growth has been deeply informed by my experiences running an intensive outpatient program for binge eating disorder and supporting individuals with substance use disorder. Throughout this journey, I encountered two distinct patient archetypes that really captured my attention. The first group, despite grappling with their addictions, flourished under a canopy of non-judgmental support, education, behavior modification, and positive psychology interventions. These clients exhibited the classic signs of post-traumatic growth, such as increased appreciation for life, belief in personal strength, recognition of new possibilities for one's life, enhanced spirituality, and deeper relationships. Conversely, the second group found themselves caught in a vicious cycle of further substance abuse and depression, even within the same supportive holistic care framework. They were often swept up in addiction switching, self-sabotage behaviors, or other PTSD symptoms. Despite having similar trauma histories and a similar burden of adverse childhood experiences, there was a chasm that separated these groups. The second group held a pervasive belief in their unworthiness and unlovability. For those that were entrenched with a victim mentality, traditional approaches such as psychotherapy, meditation, journaling, and positive psychology interventions often fell short. And this is what led me to focus on self-love, helping clients heal past wounds and reprogram the subconscious beliefs so that they could align with a healthier sense of self. And that is what is built into the Cornerstone Process framework. Now, over 2 decades later, my exploration and application of psychedelic-assisted therapy in clinical practice, coupled with its transformative impact on my own personal trauma healing journey, it has really crystallized my belief in its potential as a beacon of hope for those seeking to transcend trauma and ACEs. Psychedelic-assisted therapy offers a unique pathway for reprogramming deeply ingrained beliefs of unworthiness, rewiring neural pathways towards greater compassion and empathy. And it helps to orient individuals towards a future that is brimming with possibilities. This is achieved through a strengths-oriented holistic framework during the preparation and integration phases. And that's specifically designed to foster post-traumatic growth. Post-traumatic growth has been profoundly defined by researchers such as Tedeschi and Calhoun as positive psychological change experienced as a result of the struggle with highly challenging life circumstances. Their groundbreaking work has been supported by a wealth of studies, which has illuminated the transformative potential inherent in trauma. They've categorized post-traumatic growth into domains that encompass a greater appreciation of life, improved relationships, enhanced personal strength, new possibilities, and spiritual development. The advent of MDMA-assisted psychotherapy, alongside other psychedelic therapies, represents a frontier in the promotion of post-traumatic growth. These treatments, with their unique ability to facilitate deep emotional processing and cognitive flexibility, offer a promising adjunct to conventional therapeutic modalities. It's within this context that the Cornerstone Process emerges as a holistic framework meticulously designed to maximize the benefits of psychedelic experiences. Rooted now in over 2 decades of clinical practice and group work, this comprehensive approach is tailored to support individuals in their healing journey, leveraging the transformative power of psychedelics to catalyze profound personal growth and resilience. Through the lens of the Cornerstone Process, we embark on a journey to explore the depths of the human psyche, unlocking the potential for healing, recovery, and the awakening of the authentic self. This approach not only paves the way for a redefined sense of self in the aftermath of trauma, but also opens the door to a life enriched by a deeper connection to oneself and the world. So let's go deeper. My tenure directing the intensive outpatient program for binge eating disorder really served as the crucible for a transformative encounter with Dr. Martin Seligman's seminal work, Learned Optimism. I felt as though I had stumbled upon a vital key, one that could unlock my patients' inherent potential to transform their core beliefs and identity structures through the lens of positive psychology. This revelation inspired me to enroll in one of Seligman's inaugural programs for clinicians, which featured guest lectures from luminaries such as Mihai Csikszentmihalyi, the flow expert. This experience unveiled new methodologies to assist my clients in recognizing how their past experiences had programmed them to adapt in the best ways that they knew at the time. And it illuminated how, through dedicated focus and a variety of practices, my clients could return to their authentic selves, aligning with who they truly are or who they might have been had they not been wounded or traumatized. It showed me how they could unlearn their victim mentality and embrace a healthy sense of self. This journey culminated in the birth of the psychoeducation and positive psychotherapy practices that are interwoven into the Cornerstone Process. This 5-step process is well designed to enhance self-awareness, resilience, self-love, sovereignty, and personal growth. The steps are awareness, acceptance, accountability, inspired action, and appreciation. It's a guiding framework for self-actualization, or in Carl Jung's term, individuation. And in the terms of alchemy, it's all about purification and refinement into one's highest potential. Since 2005, I have woven together research and practices from a diverse array of disciplines included in this framework. And they include neuroscience, for understanding the brain's ability to rewire itself in response to new experiences and thoughts. Positive psychology, to cultivate a mindset oriented towards growth and fulfillment. Transpersonal psychology, which extends beyond the individual to consider broader existential and spiritual dimensions. Cognitive therapy, for identifying and challenging unhelpful thought patterns. Mindfulness meditation, to foster a state of present moment awareness and acceptance. Narrative therapy, enabling individuals to rewrite the stories they tell about their lives. Internal family systems and Gestalt therapy, for identifying and healing various subpersonalities or parts within oneself. Addiction medicine, to address the physiological and psychological aspects of substance use disorders. And Eastern spiritual philosophy, providing insights into the interconnectedness of all life and the journey toward enlightenment. The Cornerstone Process is now a comprehensive, clinically validated, holistic framework. It can be embarked upon as a self-guided journey or with the support of a doctor, therapist, or coach, guiding individuals step by step toward holistic healing to address the multifaceted aspects of the individual's being. Trauma recovery, for healing the wounds of the past and breaking free from their grip. Reparenting the inner child, to nurture and heal the most vulnerable parts of oneself. Preparing for and integrating psychedelic experiences to maximize their transformative potential. Building resilience, to cultivate the strength to face life's challenges. Creating a foundation for real self-love, fostering a deep, unconditional acceptance of oneself. Reclaiming sovereignty, to stand in one's power and make autonomous decisions. Developing personal mastery and individuation. Designing a life of purpose, intention, and soul alignment. Rewriting the personal narrative to author a new story that reflects one's true aspirations. Rewiring the brain, leveraging neuroplasticity to cultivate beneficial thought patterns and behaviors. And finding the authentic voice to express one's truth with clarity and confidence. Individuals grappling with depression, anxiety, burnout, attachment wounds, substance use and eating disorders, adverse childhood experiences, racism, sexual trauma, and codependency, have found profound relief and transformation through the Cornerstone process. This approach not only facilitates healing and growth, but also paves the way for a life marked by enhanced self-awareness, resilience, and a profound sense of fulfillment. So, let's explore how to use the Cornerstone process within a framework of psychedelic-assisted therapy for preparation and integration. In recent years, the field of psychedelic therapy has witnessed a paradigm shift, moving beyond traditional deficit-focused models toward a more holistic and integrative approach to healing and personal growth. This evolution is well documented in a comprehensive review published in Frontiers in Psychology, which explores the multifaceted models of psychedelic integration currently in practice. The paper's authors acknowledge a growing need for mental health specialists to be able to provide adequate and effective intervention regarding the content and consequences of psychedelic experiences in what we now call psychedelic integration. The paper presents proposed comprehensive guidelines covering both theoretical and practical aspects of psychedelic integration that are intended to serve as a resource for various mental health specialists and coaches who may encounter individuals in need of support for their psychedelic experiences. I encourage you to check it out. In summary, the authors found that multifaceted psychedelic models are characterized by their holistic nature. They incorporate elements from psychological, somatic, spiritual, and community and environmental domains, embracing a wide array of therapeutic approaches, including transpersonal psychology, Jungian analytical psychology, and third-wave cognitive behavioral approaches such as acceptance and commitment therapy. The review highlights a critical transition in psychiatric and psychotherapeutic practices, emphasizing the importance of leveraging patients' inherent strengths and their positive personal and social resources. Just like in my discovery of positive psychology through the program that I took with Dr. Seligman, this approach marks a departure from the traditional focus on fixing deficits towards fostering an environment where individuals are seen as whole beings with the capacity for self-actualization and growth. Such resource-oriented models have been shown to not only directly impact the symptoms of a defined disease or disorder, but they also enhance the overall well-being and resilience of individuals, which facilitates deeper and more meaningful therapeutic outcomes. The findings from the Frontiers paper serve as a compelling foundation for the integration of the Cornerstone process in psychedelic therapy. By aligning with the principles of holistic and strength-based approaches, the Cornerstone process offers a structured yet flexible framework that supports individuals in navigating the complexities of their psychedelic experiences. As we delve into the nuances of the Cornerstone process, we recognize its synergy with the key themes identified in the review, highlighting the significance of focusing on clients' strengths, worldviews, and personal values as a means to foster post-traumatic growth, resilience, and the awakening of the authentic self. As we explore the application of the Cornerstone process within the context of psychedelic therapy, it becomes evident that this approach not only complements, but also extends the holistic models discussed in the review. By integrating the Cornerstone process with the insights gleaned from current research, therapists and individuals alike are equipped with a robust, evidence-based framework that promotes healing, transformation, and an enriched sense of purpose and connection in their lives. So, with all of this background and context, now let's look at each step of the Cornerstone process in depth.